That new warning from the CDC about the coronavirus here in the U.S., saying it is not a question of if, but when.
September 2020 marks a grim milestone for the U.S. Over 6 million infections and 200,000 virus deaths, accounting for a quarter of the world's fatalities.
It is being compared to Pearl Harbor, D-Day, and 9/11.
America shut down, the coronavirus soaring in the U.S.
ABC News looked back at the last 6 months of life during the coronavirus pandemic. How we got to this milestone, what went wrong, and how it's still impacting us all. In September 2020, CNN obtained audio recordings of President Trump speaking with journalist Bob Woodward in February and March about what he already knew about the deadly coronavirus.
It goes through air, Bob. That's always tougher than the touch. It's also more deadly than your strenuous flus. I wanted to always play it down. I still like playing it down.
Yes, sir.
Because I don't want to create a panic.
This is a flu. This is like a flu.
Many epidemiologists and public health professionals were sounding the alarm bells back then, but that was met with resistance from the top, and that confusion led to a patchwork of responses.
I didn't lie. What I said is we have to be calm, we can't be panicked. And before any statement was made, you have to remember, I put the ban on China. So obviously, outwardly, I said, it's a very serious problem. We're going to get through this, and we're right now, I hope, we're rounding the final turn. And a lot of good things are happening with vaccines and with therapeutics.
While some countries around the world seem to have effectively handled the spread of COVID-19, cases in the U.S. have continued to rise.
I think not responding forcefully and quickly with a strong national or federal level response to this at the beginning of the epidemic was one of the biggest missed opportunities, I would say, to get this under control.
Chronic underfunding of public health, inadequate testing, and gaps in leadership are often cited as reasons for how the coronavirus became widespread in the U.S.
The system is not really geared to what we need right now, what you are asking for. That is a failing.
And failing, yes.
It is a failing. I mean, let's admit it.
Since the first cases of COVID-19 were reported out of Wuhan, China, scientific understanding of the novel coronavirus has evolved.
This is a new disease. The science on it is very young. We are learning new things on a daily, weekly, monthly basis. So we would expect information to evolve.
Now, early on, the recommendation was not to wear a mask because of the shortage of it. Two things happened. One, it became clear that we had enough of the equipment. It became clear that cloth coverings that you could make yourself were adequate. And probably the most compelling thing is when it became very clear that anywhere from 20 to 45% of people who were infected didn't have any symptoms. So everybody should be wearing a mask.
More than 6 months into the pandemic, there are still critical questions that remain unanswered. One point of concern and confusion is scientists' understanding of how the virus affects children.
Children do appear to be infected a bit less frequently than adults, and the course of their illness tends to be much less severe. That is not necessarily consistent across all racial, ethnic, and socioeconomic groups. Similarly to adults, we do see that Black and Brown children are more significantly affected by COVID infection.
While children represent less than 10% of reported cases, over 500,000 kids have tested positive for the coronavirus. In an August 14th study, the CDC found that 1 in 3 children hospitalized with COVID-19 ends up in the ICU, the same rate as adults. For many people, the impact has also been on mental health. The percentage of adults reporting symptoms of depression more than tripled during the ongoing coronavirus pandemic.
People are reporting a lot more anxiety symptoms and a lot more symptoms of depression and just overall elevated level of stress currently than they were a year ago at this time.
With Americans facing record unemployment and long-term isolation, experts worry there may be an increase in suicides.
Stress in and of itself sometimes helps us to act and respond and take care of ourselves. But when it's long-term and overwhelming, it begins to become chronic, which then has negative mental health and physical health impacts.
A poll conducted in mid-July found that 53% of adults in the United States reported that their mental health had been negatively impacted due to worry and stress over the coronavirus.
We have inconsistent information about what to expect with the pandemic, with the economy. Now we've got the election coming forward.
62% of voters say the outbreak will be a very important factor in their decision about who to support in the 2020 presidential election. And with no end in sight for the coronavirus outbreak in the US, many Americans are wondering, where do we go from here? As the country braces for a possible second wave of COVID-19 this fall, some experts say the spike in cases may not translate into an equal spike in deaths.
The more that we learn about the virus, the more we know how to properly treat, what the right therapeutics are, what the right protocols are for patients. And so our learning increases, and that in itself will translate to fewer deaths. Clearly, we have the horizon of a vaccine, but there are many question marks about that vaccine.
On the chance that the vaccine could be available early, and Dr. Fauci and Dr. Salawi both say that's possible, even though not probable. We want to make sure states are ready to distribute it.
Gallup's COVID-19 tracking survey found that even if a vaccine were FDA approved and available at no cost to the public, 65% said they would get the vaccine, while 35% said they would not.
And so we can't necessarily just rely on the vaccine as a silver bullet. It's going to be about the full suite of sort of interventions that we've been doing up until this point that sort of gets us to the other end.
Even without a vaccine, states have begun reopening schools and businesses with mixed results. Experts are encouraging people to get the flu vaccine and continue following social distancing measures as we approach the fall season.
This could be even much, much worse, right? These numbers we could be hitting, a 300,000 or 400,000 milestone by the end of the year if we don't get our act together. And so, unfortunately, this story isn't over.
And it doesn't have to be this way the back half of this epidemic at all. There's still time. There's always time to turn the ship around.